friendly reminder that foam rolling your IT band does jack all for actually reducing tightness in that area. Before you get mad at me, just hear me out. Please just hear me out. Stick around for a little bit. Listen to this, you're gonna learn a lot. But first, we're gonna talk about a little bit of anatomy so you have a visual and you understand what we're talking about. So the IT band is a thick piece of fascia that runs down the outer part of the leg. Up at the hip, it kind of connects with the tensor fascia latae muscle as well with the glutes. Now down at the knee, it inserts onto the femur or the leg bone, as well as the patella and then the tibia, which is the lower leg bone. Now, the IT band's job is to help tense up that tensor fascia latae, or TFL, as well as help move the hip up, down, outward, and rotation, as well as stabilizing the knee and then transmitting forces down the leg. But sometimes she's a little extra. But that doesn't mean we foam roll her, because fascia is a really, really dense connective tissue that doesn't just deform when we roll on it. It actually takes about 2,000 pounds of force to deform the IT band by 1%. So unless you're sitting on the ground with a steamroller over your leg, or you have a scalpel, you're not really changing the state of that tissue. And if you think foam rolling is what's gonna change it, you're basically trying to throw a sponge at a brick wall. So here's what we're gonna do instead to help you out. First things first, we need to reduce or just modify the intensity, frequency, or volume of whatever type of exercise you're doing that's pissing it off. This does not mean complete rest. This just means a temporary reduction in things that we're asking this area of our body to do so that things can simmer down. And then we're gonna do an assessment. I'm looking for things in the hip, the knee, the lower back, the pelvis, the ankle, and the foot, to where you may have discrepancies from side to side, whether that's range of motion, whether that's stability, or whether that's overall strength. And based on that, that's where the exercises come in. Things like hamstring bridges, split squat isometrics, lateral step downs, calf work, side hip plank raises to help tackle that glute med. Now these exercises just aren't a copy and paste. You can't leave this little chit chat we're having and be like, okay, Susie, I'm gonna do everything you just said and my IT band is gonna be a happy little camper. No. Your exercises should be matching what I'm finding on that assessment so that they are specifically tailored to you and what you have going on, instead of just throwing spaghetti at the wall and seeing what sticks. Now things are gonna start to feel better, but you can't just return to your previous activity that you were at before, because that's just gonna piss things off all over again. So we have to take a graded approach, progressing slowly over time in order to get you back to where you were before. Tissues need time, consistency, and loading, not just sudden spikes of activity and wishful thinking. Moral of the story, if you're having that pesky lateral knee IT band related pain, your IT band's not the enemy, and foam rolling the hell out of it is not the solution. If you do want to do some foam rolling, let's focus on the soft tissues like the glute med, the TFL, the glute max, the hamstrings, or the lateral quad for some short-term relief. But that lasting relief is going to come from smart programming and assessment, progressive loading, and addressing the actual root cause of why you're having these issues in the first place.